Wakati una battle cancer, in terms of money, kama una pesa, ukweli ni kwamba utakufa tu. Kwa sababu hakuna shortcut. Na familia inakutenga. Kwa nini inakutenga? Wewe sasa umekuwa mtu wa kuwakula. I mean, hiyo ugonjwa yako inakula pesa zao, resources zao. Hata ukiwa na transport na ufika hospitali na una pesa, huwezi tibiwa. So kama ingekuwa kama janga la kitaifa, ikuwe kama HIV. Unachukua dawa na unaenda nyumbani. Watu wengi wangepona. As long as hauna dawa, huwezi survive na cancer bila pesa.
The cancer burden is growing worldwide. But what makes it particularly striking and why we call it a cancer emergency in Africa is because if you look at the cancer incidence and mortality compare, right? So if 100 people have cancer in Africa, you're going to have 80% of those people die, so it's really, they don't have access to the same kind of treatments and, all the infrastructure that is common in countries like the United States and Europe. Africa has about 2,000 languages, so dialects. In some of these dialects, we don't have a word for cancer. I grew up in a village like that. So we call it something else. It's witchcraft, it's, some other thing. What happens then is that people die and they're never really counted as cancer. I mean, you can't even begin to treat something if you do not have a name for it. You don't even know what it is. You're calling it something else. If you take countries like Niger, right? If you take countries like, Cameroon, where I was talking about, those countries, Chad, Central African Republic, these countries are really, there are some countries that do not have, among these that do not have, a cancer center, a radiotherapy center, for example, which means that, if you have cancer, you can't even get palliative care from radiation therapy. You can't even just get a dignified death. You have to die a painful and distressful death.
And in fact, you can take this as a measure of a country's development, in that where the country is still slightly less developed, you find that cervical cancer comes up first, and where the cancer is better developed, then you find breast cancer comes first. The numbers should be coming down, because when you have more specialized centers, when you have more specialized personnel, they should be able to cope. You have earlier diagnosis, treatment, the cure rate should go up. So if you are looking at case by case, then the numbers of deaths per cancer case should be going down rather than increasing, and they should be all over the world.
Most of the countries that are poorer, where there may even be war, like I gave Central African Republic, for example, these countries have, the situation there is worse. Sometimes they have to travel to neighboring countries to get cancer care. Africans are living longer. Okay, so it used to be that Africans were dying of all these infectious diseases, malaria, HIV/AIDS, and all of that. And cancer usually is late age, usually comes when people are living longer. And so that's why there's been this massive surge, and we think we're not capturing enough of this, So people living longer, the demographic shift because of that is a big factor. I would say to the top ones are infectious diseases, demographic shift, and then you want to talk about the environmental factors. You want to talk about the diet changes towards westernized lifestyles. And so, all of these things are contributing, obviously, in a complex way, but those are the top ones.
I know these countries. So when one says, oh, there's going to be this, I mean, that really is looking at it as if these countries were just sitting there waiting for disaster. They are not.